Hi, it's Jessica DeMassa with WTF Health. Joining me right now, I have Dan Trigub. He is the head of Uber Health.
Yes, thank you for having me.
Hi.
Awesome to be here.
Awesome to have you. Okay, so I want to start out by talking about this deal with Cerner.
Yes.
So tell me the specifics of it. I want to know how much you're getting paid. No, I'm joking. But no, tell me how this works. So what is happening? So basically, Uber is going to be something that someone can order from the EMR.
Yeah, so step back for a second. Cerner has been in healthcare for over 40 plus years. They have 5,200 hospitals that they serve across the globe, and they touch over 220 million patients through their platform. So today at Uber Health, we have over 1,000 partners, many of which are large health systems that we work with, many of which are also Cerner users. So right now, we typically would partner with a health system. They have access to a standalone dashboard that we've built with HIPAA controls. So I'm a care manager at a hospital like Baycare. I go into the Uber Health platform, I can order a ride for a patient. The analogy or the example I always give is that care manager is on a swivel chair. They're in the Uber Health platform, and then they swivel their chair over to Cerner and are in the EHR getting all the patient information. What we're now able to do is fully embed and integrate directly into Cerner. So now I'm a Baycare case manager. I don't have to swivel my chair. I'm with a patient at the discharge moment in time, and I can go in, pull information from the electronic health record, pull a pickup and drop-off location, the patient name, and in less than a few seconds order a ride on behalf of my patient. And now it gives us access to all of Cerner's customers. We'll be starting here in the US, working with a few pilot partners, and expanding broadly next year.
That's so exciting. I mean, this really changes the game for you guys
Yes.
in terms of just making this something that is within the clinician workflow, which is really important. So, I mean, it took a while to get to this point. And now that you're here, I mean, what are you, I guess, most excited about in terms of what the potential is for this partnership moving forward?
Yeah, so I mean, we're just at the tip of the iceberg. As I tell my team every day, this is the first pitch of the first inning. I mean, there's so much work for us to do. I think what has been clear is that data has shown over the last couple of years that the power of transportation to get people to and access the care that they need is critical. The overused statistic now in the industry is close to 3.6 million medical appointments are missed every year. Everyone knows that number. But the thing I would also say is the CDC has now come out and said that access to transportation is a key social determinant of health.
Yeah.
And much of our aging population, where the population is growing, transportation is core to their lives. So I think for us, the data is now out there. Boston Medical Center, another one of our partners, recently published a study showing we've reduced costs, reduced no-shows and missed appointments, and patients who have access to Rideshare have higher NPS scores. So the impact we're having on the health system is tremendous. So for us, it's how do we build deeper interoperability with existing systems like a Cerner, and then also how do we continue to expand our footprint beyond even just providers, but also payers as well.
Okay, I wanted to ask about the Medicare Medicaid population because you kind of touched on that for a second. So tell me a little bit about this user base for you guys. Is this a population of patients that you guys have been able to connect with really well? Because I would think even in just normal course of everyday life, these are not your typical Uberers. Like, I mean, they're just not. So how are you guys connecting with them? Is it really up to that case manager who's deciding this stuff, or are you able to build a relationship directly with those patients?
Okay, so how it works, and I'm going to get a little bit into the weeds here for your audience and give them the kind of the nitty-gritty behind the scenes here. So first and foremost, to your point, when I was at Health last year, the conversation is what the heck is Uber doing in healthcare, right? Right? Like WTF,
Yeah,
right?
Exactly.
So,
exactly.
and I think people, when they hear about us, they say, you're just taking a millennial to a bar on a Friday night. That's what you do in downtown San. Well, that couldn't be further from the truth when we think about our aging, low-income, and at-risk population, much of our Medicaid and Medicare population. So now, to get into the weeds, the U.S. government every single year spends close to $4 billion on non-emergency medical transportation. It's about 1% of all of Medicaid spending today. And the government and regulators and policymakers have realized that access to transportation is critical to get the people to the care that they need. Now, historically, 80%, and even today, 80% of these rides are ambulatory curb-to-curb rides, and historically they were using traditional livery and taxi providers to fulfill these trips. And a step deeper here, there are what are called non-emergency medical transportation brokers, or the acronym is NEMT. Okay. These are large companies who manage the transportation benefit on behalf of the state Medicaid agency or an MCO or an ACO or a large health plan. These brokers integrate with various transportation providers to service the needs of the population of these health plan members. And again, remember, the vast majority of these rides are curb to curb. And historically, these brokers were using taxi providers to do these trips. What now they're able to do is integrate with our APIs and our technology and leverage Uber Health when it comes to getting these people to the care that they need. again, elderly, low income, underserved populations. Now, our technology enables so that the person taking the trip does not need a smartphone, does not need an Uber app, does not know anything about our platform. These are all coordinated upon their behalf. So we really empower these brokers, these care coordinators, to better serve the people they care for through our platform at Uber Health. We are 30 to 40% more cost effective than other alternatives. A major issue with non-emergency medical transportation is waste, fraud, and abuse. A lot of this is paper pen receipts, and now it can be fully automated through our platform. And then finally, we see higher patient satisfaction scores. So we're now integrating with these large national brokers, and we're servicing health plans all across the country. From a regulatory standpoint, so I know one thing we talked about earlier, some of the challenges we're facing.
Yeah, get into that.
From a regulatory standpoint, CMS and HHS put out regulations for non-emergency medical transportation before rideshare ever existed. They would have never imagined a model like ours. So the regulations on a state level for Medicaid require that drivers have fingerprinting, drug testing, certain things that no rideshare company does for a variety of reasons, and we believe the systems and the background screening we have in place are sufficient for the populations that we're serving. So what is now happening is the regulations are changing. Florida, Texas, and Arizona recently passed regulation to allow rideshare to do non-emergency medical transportation. Regulators and policymakers are really recognizing the benefits that we can bring to the health ecosystem, and the data showing it in the studies that have been published. Arizona in particular has been very forward-thinking around rideshare for Medicaid transportation. Jamie Snyder, the state Medicaid director, was actually here at the conference the other day. And we are now servicing 15% of all Medicaid trips in the state of Arizona with rideshare, with the changes that they've made there. And we're a big player in the state with them and the work we're doing.
What was so progressive about the way that they had structured their regulations?
So basically allowing essentially a vehicle class, a vehicle type for rideshare for an Uber. And the analogy I always give is, when Uber started in 2009, there's maybe 2 or 3 cities and states that allowed for transportation network companies, TNCs, to operate. Fast forward to 2019, there's regulations passed in almost every city and state for rideshare. And CMS is now recognizing this. They're putting out, we're spending a lot of time with CMS to help the states kind of see the power of this. Senator Todd Young from the state of Indiana wrote an open letter to CMS recently advocating for rideshare. And now we're doing a lot of work with each of the state Medicaid programs. Those 3 I mentioned earlier are some of the most progressive. And we do believe other states will follow, given the benefits that they see.
I love hearing this because I think, like you said, it's like the conversation has changed, even in such a short period of time, from, WTF are you doing here, to no, I mean, and the regulations have changed as well. I want to ask, because, I mean, obviously, you guys are a division within a much larger company, and so we all are familiar with, the plight of Uber and Lyft and other regulations and other challenges that you guys have. I wanted to ask, specifically about, business model, and I wanted to ask about how Uber Health fits into Uber's bigger business model. I mean, we often hear, okay, well, when is the company going to be profitable, blah, 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 blah. And it's like, how is Uber Health as a division within Uber? Are you guys profitable? It sounds like you've got a lot of good, uptake.
Yeah, so a couple things I say to that point. It's a huge part of our mission and our initiatives at Uber is investing and believing into Uber Health. I mentioned earlier, we want to serve a lot of the underserved populations in the communities we operate in, and we want to be a good steward in these communities. And I was a caretaker for my grandparents, right? My grandmother, when we took away the car keys, or when she actually even came to this country, she would never have imagined having a car, right? And social isolation, lack of independence for our aging population is a major issue, and we think rideshare can play a big role in that. So for us is we really want to invest in Uber Health so we can better serve these underserved populations. Now, what I'd say is we don't break out data or revenue by any certain vertical within Uber. But in our first earnings call, if you go back to that first earnings call, Dara did mention we've seen 400% growth year over year in Uber Health. So certainly we're seeing a lot of great progress and a strong trajectory of our business. Today we have over 1,000 partners and customers using Uber Health through our standalone platform, our APIs. And the thing is, keep in mind, we are serving populations that normally would never have ever had exposure to Uber or taken an Uber, right? Our Medicaid population. We're now creating new opportunity for Uber to access markets where normally, again, we wouldn't have a presence. And we think this can certainly help grow our presence across the country and even beyond.
No, I think that's exciting. And I mean, I think your integration with Cerner is going to be, I think, a game changer for you guys. So congratulations on that.
Thank you. I appreciate it.
Yeah, lots of good stuff happening at Uber Health. So yeah, you've earned your place in healthcare. I mean, actually, as you're talking to me about the regulations, I'm like, wow, you actually sound like a healthcare company. That's pretty cool.
And that's what we hope to kind of exude that. And we have an amazing team. We've brought on many healthcare professionals who truly understand the nuances of the industry. And, Uber from day one wasn't built for healthcare. We weren't designed for this use case. But given our platform and our reach, one thing we didn't mention is meal delivery.
I was just going to say, when are we going to get Uber Eats in a hospital so you don't have to eat that food?
So many Medicare Advantage plans actually pay for meal and grocery delivery. We think we can be a big player in that space as well as pharmaceutical delivery, durable medical equipment delivery. We have a world-class logistics platform. So when you hear Dara, when he talked about Uber during our, over the last couple of months, he talks about being the Amazon, the center, the hub for all transportation, logistics for our community. And we think Uber Health plays a big part in that. Healthcare is a huge issue and also a global issue. Right now, Uber Health is just the U.S., but we do hope to expand internationally as well.
So exciting. Love to see you guys expand even the concept of Uber Health from just patients to other things that can be taken back and forth. Very cool. Dan, it's a pleasure to talk to you. Thank you so much for joining us.
Thank you for having me.
Thank you. I'm Jessica DeMassa with WTF Health. Thanks for joining us.